D, E. But as we said, for this, we're gonna keep it normal, okay?
A, B, C, D, E of what?
The eighth
Skin
amendment,
assessment.
Okay,
symmetry.
gotcha.
Okay, hang on. Okay, head, okay. I'm gonna now go to the head, but while I'm at the head, I'm also gonna be examining the, lymph nodes. Yeah, no, the cranial nerves we're gonna leave and do at the last part, okay? So I'm gonna do them all along since we haven't, so here we go. I'm gonna be pressing the top, I'm now touching her frontal sinuses. Do you have any pain?
No.
Okay, there's no pain to bilateral frontal sinuses. Do you have any pain? No. And while I'm up here, I'm also gonna look at her conjunctiva. Please open your eyes wide. Okay, conjunctiva is pink, there's no discharge, there's no lid lag, pupils are round and even, lids are pristine, there's no lesions, and, what else can we say? The rest will be cranial nerves with the curling. We won't do that right now. And I just want to press up here on the lacrimal apparati to make sure there's no discharge. So as I press the lacrimal apparati, there is no tenderness and there's also no discharge, okay? And underneath, just to make sure, because the intercanthus is where you pick up abnormalities, which would be here. But no, there's no tenderness or discharge, okay? And we did say that maxillary sinuses are non-tender, correct? Okay. And just let me also palpate her TMJ, open and close, please. Great, okay, TMJ is non-tender. Did that hurt you? Okay, TMJ joint is non-tender, and there's no clicking or subluxation. Okay, now I'm gonna do the lymph nodes. Remember lymph nodes, we check for adenopathy, which is enlargement, and we also check for what? Tenderness. So, we're gonna do them in order, the best I can. Bilateral you let me know if anything hurts. See, you take your fingers in a rolling motion. Is any pain?
No.
Okay, just let me know that. Bilateral pre-auricular lymph nodes are non-tender to touch, and there's no adenopathy. Bilateral what? Tonsillar, non-tender to touch, and no adenopathy. Anterior cervical, non-tender to touch, no adenopathy. Submandibular, bilateral, non-tender to touch, no adenopathy. Submental, no adenopathy, non-tender to touch. Then I go in the back, right in the back, which would be this area, and that's the post or the occipital. Occipital, right here, guys, right here, okay? There's no tenderness and there's no adenopathy. And there's also a posterior chain. Posterior cervical chain, non-tender to touch, and there's no adenopathy. Notice the anterior chain I did separate. Why? Yeah, good job. We okay? Good.
Did you do separate? I'm sorry.
I didn't finish, thanks. Postauricular, non-tender, no adenopathy, and please shrug your shoulders to me. Bilateral supraclavicular lymph nodes are non-tender and there's no adenopathy. I didn't want to touch the carotids at the same time, just in case. Okay? There's also, while I'm up here, there's also, vessels, right? There's some pulses. We're going to do them. And we always check for equality, all right, the best we can. So we're going to do right up here, temporal, bilateral temporal arteries, +2, equal and present, right? Let's see. I'm trying to think. Carotid, yeah, I don't, you know what, because I don't have the stethoscope on, okay. What I would do is just gently touch the carotid and say, okay, I know on the left one, now I'm on the opposite. Bilateral carotid arteries are +2, they have a brisk upstroke, okay? Now, I also use my stethoscope, and I use what? The diaphragm, and I'm listening for what, I'm sorry, the bell, I apologize, right. The bell, and I'm listening for a bruit. And I'm listening, and there are no bruits, bilateral carotid arteries, there are no bruits, okay. All right, where are we going next? A lot of pressure being
Didn't check
taped.
my scalp and all
We're
of
not
that. I
done
didn't
yet.
have to
We're
put
not
my
done.
makeup on.
Oh, I'm sorry. See, sometimes you get difficult patients no matter where you work. They come from all different places.
Get a good angle.
All right, I'm gonna check her scalp. I'm trying to stay, and scalp is non-tender, right?
Yeah.
Hair distribution is even, no alopecia, and, no lesions, there's no tenderness. There's not much you can say. No alopecia, no tenderness, and, there's no flaking, there's no nodules, okay. I did your temporal, I did your, yeah, I know, but I'm trying to think of all the pulses, but you know what, it's as we go down further. Okay, now I'm gonna look in your ear. You tell me if there's any problem, if anything hurts while I, look in your ear. All right, here we go. Does it hurt when I tug at all?
No.
So no pain with the tragus tug? Okay, here I am. I'm at her left ear. And I can tell you the external canal is clean, free of debris, and there's no cerumen. Tympanic membrane is intact, there's no bulge, there's no retraction, and there is a good cone of light, and I can see the malleus. Feel free to help, no problem. It's good. And I'm going to tug up and back again, and I can say, okay, there's a scant amount of cerumen in the canal, otherwise it is free of any discharge or foreign body, and tympanic membrane are intact, and there's a good cone of light, malleus visible, there is no retraction or bulge. Okay, while I have this here, I am going to look in her nose, and I'm not going to hurt her. I take the tip of my finger, and I just gently go like that. And I go like that, and I'm looking at the mucosa, okay? And I can tell you that the mucosa is hyperemic, as it should be. There's no discharge, and septum appears to be non-deviated. The next place I'm going to look, because I'm going to save her eyes for when I do cranial nerves. Say ah for me, please. Big ah. Okay, uvula rises on phonation. I should have a tongue blade. You guys want to stop for a second? Just for 1 second?